Good morning, Academy Nation and friends, and welcome to the second edition of our post-NAIC webinar, where American Academy of Actuary staffers will review hot topics discussed during the National Association of Insurance Commissioners summer meeting in Chicago and look ahead to the fall meeting in Denver as well. My name is Ted Gotch, and I am the Senior Policy Analyst for Content and Publications at the Academy. I'm your host for this webinar, which will pull back the curtain on what went on at the NAIC conference in Chicago, as well as discuss pending issues likely to be tackled in the near future. I'm here with my colleagues Amanda Barry Moylan, Will Beneke, Rob Fisher, Ramzia Sharkova, and Matthew Williams to break down the goings-on from the Windy City. And you'll be hearing more from them in a moment. This is a previously recorded event, so there will be no questions taken. If you do have comments or queries, feel free to reach out to us at publicpolicy@actuary.org. The slides from this webinar will be available in the Academy Slides and Resources section. Here's a look at the agenda for this event. In a moment, I'll be joined by a special guest. Then we will hear from my colleagues for the specifics on what happened in Chicago from each practice area, as well as in research. Finally, we'll wrap up with a quick preview of what we will have to look forward to at the NAIC fall meeting. But right now, I'd like to introduce to viewers Eric Harr, the Academy's new Director of Public Policy Outreach, who will tell us a little bit more about himself, as well as share some high-level reflections from Chicago. So Eric, fill us in on your background and how you ended up at the Academy.
Well, thank you for that. I am indeed Eric Harr, the Director of Public Policy Outreach for the American Academy of Actuaries. I had a career for 17 years working for the Federal Home Loan Bank system. I did their government affairs, which meant outreach to members of Congress, as well as trade associations and a variety of other stakeholders. Just this past summer, I joined the Academy to assist with their outreach efforts, and I'm very pleased to be on board.
Excellent. Well, you got off to quite a start here, sort of being thrown in the national meeting right off the bat. What were some of the highlights of Chicago, especially when it came to professionalism and interacting with our volunteers?
So that's right. So as we do at every national meeting, the Academy offers updates from the Committee on Qualifications, the ASB, and the ABCD during each actuarial task force. These updates offer the regulators and other actuaries in the room, along with the non-actuaries, the chance to hear about some of the priorities and opportunities to engage in the public comment process of actuarial standards of practice and Academy professionalism priorities. It also offers the Academy the chance to remind the regulators of the various professionalism resources that the ASB and the ABCD offer them in their roles as regulators and as actuaries. Unique to the Chicago meeting was a series of presentations to the Life Actuarial Task Force and the Health Actuarial Task Force. Following the fall 2023 national meeting, the Academy was asked by LATIF to draft some knowledge statements outlining the knowledge necessary for life actuaries signing certain statements of actuarial opinion, including the roles of appointed actuary, illustration actuary, and qualified actuary for principles-based reserves. Since last November, key leadership of the Academy has been drafting the appointed actuary knowledge statements for both life actuaries and health actuaries, leveraging a series of discussions with key LATIF and HATIF regulators. In Chicago, the Academy's Lisa Slotsnik, Daryl Knapp, and Rhonda Aherns presented to LATIF and HATIF the current drafts. LATIF has exposed the life-appointed actuary knowledge statements for a 30-day public comment period while HADIF will be scheduling a follow-up call to discuss the health-appointed actuary knowledge statements. The Academy, of course, will continue to work with the regulators, and we are committed to submitting final versions of the drafted statements at the Denver Fall National Meeting in November. And finally, the NAIC meeting is not complete without an Academy cross-practice dinner. More than 50 volunteers, regulators, NAIC staff, and other key stakeholders join us for dinner and some really great casual conversation. And with that, I'll pass it back to Ted to get us started on the practice area updates. Ted?
Eric, thank you for that. So right now, I'm going to turn to Amanda Barry-Moylan, the life policy analyst, for her recap on what went on in Chicago from a life perspective. Amanda?
Thank you, Ted. My name is Amanda Barry-Moylan, and I am the life policy analyst for the American Academy of Actuaries, as Ted mentioned. I'm going to briefly discuss the activities of the Life Practice Council at the NAIC National Meeting. The Life Practice Council is extremely responsive to the Life Actuarial Task Force, or LATIF, which sits under the NAIC's A Committee. In addition to LATIF, the Academy staff and members of the LPC interacted with the GOES subgroup, which reports to both A and E Committee, and Oliver Wyman on the Generator of Economic Scenarios project, and the VM22 subgroup, and the Experience Reporting subgroup, excuse me. We also work with the Interstate Insurance Product Regulation Commission, most recently on the index-linked variable annuity products. Our main issue priorities coming out of the meeting include asset adequacy testing for reinsurance. The Life Actuarial Task Force exposed a document called AAT for Reinsurance Actuarial Guideline Draft, which is a draft actuarial guideline attempting to address actuarial concerns by regulators on changes in reserves when reinsurance business is ceded offshore. There are several comment deadlines in anticipation of the next NAIC meeting that the LPC will be responsive to. In addition, the VM22 field test. So our Annuity Reserve and Capital Subcommittee has been really engaged in supporting LATIF's implementation of PBR and VM22. They developed and worked with LATIF to expose field test specifications and continue to meet and assist with EY and the NAIC in preparation and execution of the field test, which is taking place right now, and the analysis throughout the course of the rest of the year. They're also working on developing a VM22 practice note. In terms of the GOES project, so the Generator of Economic Scenarios, our Economic Scenario Generator Subcommittee spent the last few years working on stylized facts and acceptance criteria for the GOES project, and they've developed multiple education sessions on economic scenarios and acceptance criteria for LATIF, and will continue to do so. In terms of interest maintenance reserves, we are interacting with LATIF a lot on this issue. Our Life Valuation Committee and Variable Annuity and Reserve Capital Subcommittee commented on the order of operations between the interest maintenance reserve and cash surrender value floor in the VM21 reserve calculation. So we continue to support that effort. Key takeaways from this meeting include our continued support on the VM22 field test, offshore reinsurance, and support for the GOES project and their model office testing, as previously stated. That's all I have for life, so I will hand it off to Rob Fisher, the property casualty analyst.
Thanks, Amanda. So I'm going to give a quick rundown of the Casualty Practice Council's activities at the NAIC National Meeting in Chicago. So in addition to the ASB, ABCD, and COQ professionalism updates, I provided an update to the Casualty Actuarial and Statistical Task Force on CPC recent publications, as well as expected papers, webinars, and seminars occurring in the rest of 2024. In addition to that update, we're continuing to stay engaged on the updated regulatory guidance coming out of the Actuarial Opinion Work Group, which feeds into CASTIF, as it impacts the COPL annual practice note that we publish every December for P&C reserving and appointed actuaries. We also had a meeting with the Cybersecurity Working Group Chair and NAIC staff ahead of their public meeting to discuss plans going forward. They are continuing to spend the rest of 2024 educating their member regulators on cyber insurance and cyber risk. and will then consider their action plan for 2025. They complemented our cyber risk toolkit that the Committee on Cyber Risk has been producing, and they called it an easy to understand resource that the task force is taking advantage of. We also shared a number of upcoming papers currently in the works that they can look forward to later this year, such as the international cyber reinsurance, the SEC reporting, and vendor model comparison. We also shared our plans with them on a cyber webinar coming in late October that they can distribute to their member regulators. We connected briefly with NAIC staff on the anti-fraud task force before that public meeting to discuss the P&C Committee on Equity and Fairness's soon-to-be-released paper on insurance fraud. That paper examines and defines different types of fraud as well as schemes, but also different groups who are affected by fraud from an equity and fairness perspective. And then finally, we spoke with the P&C Risk-Based Capital Working Group ahead of the joint meeting as they continue to implement the recommendations from our P&C RBC Committee's Investment Income and Adjustment Factors report that they published last summer. And they're also awaiting our committee's diversification across lines of business report that we're hoping to release by the end of this year, which will contain additional recommendations for the NAIC and those working groups to consider. So with that, I will pass it on to Matthew Williams to speak to the Health Practice Council.
Thank you, Rob, and thank you everyone for joining us again today. I'm Matthew Williams. I'm the Senior Health Policy Analyst here at the Academy. Just want to provide you with a few Health Practice Council updates from the NAIC meeting this past week. So a few of the groups that we talked to, we first met up with the Health Actuarial Task Force underneath the B Committee, where our Senior Health Fellow, Corey Uccello, gave an update on the premium drivers for the ACA insurance markets. We actually recently released a issue brief along with an infographic. These are available on our website. So she discussed some of those and also the infographic and the issue brief that I just mentioned. I also provided an update to the Health Actuarial Task Force on some of our just general updates with our Health Practice Council, what we've been doing since the March meeting. We've been working on a number of webinars here at the Academy for health, along with we had combined Hill visits this past April as well with key federal agency and congressional staff. So we discussed that a little bit. And then also updated the NAIC on some of the work that we've been doing with them on our H2 underwriting project through the Health Risk-Based Capital Working Group, along with some recent comments we submitted to the long-term care actuarial working group on the LTCI multi-state review approach, which I'll talk about here in a second. So we presented on those, and also our co-chairperson for our Health Equity Committee, Annette James, gave updates on our Health Equity Committee, what we've been up to over the past several months to the special EX Executive Committee on Race and Insurance, and talked a bit about what we've been doing this past year and some of the upcoming items that we're working on, including our focus on moving from cost to cost effectiveness in regards to health benefits and health equity. So those are some, the big topics that we're working on. Some of the issues that were priorities for us that came up during the meeting this past month are, like I mentioned, the 2025 Affordable Care Act insurance premium drivers. Also, the NAIC is looking at the development of a single long-term care insurance, LTCI, multi-state rate review approach. This is a discussion that's been going on for the past several years between regulators and the industry at the NAIC. So the working group had an update on that and some continued discussions on what they're working on. And as mentioned before, health equity was another priority, and using cost effectiveness as a metric for evaluating new benefits. Some of the key takeaways that we had, as mentioned, interest in our premium drivers work. We also included within that presentation aspects of rate filing. Several folks have found that interesting, and so we've been providing that as a way for folks to see how that's actually done in response to health insurance. As mentioned, the single LTCI MSA rate review approach, the long-term care actuarial working group has asked for comments on the single approach that are going to be due on September 27th. So we're going to be looking to submit comments on that. We actually submitted a comment letter on the review approach as it is now. They're looking for additional comments. So I know that the regulators have definitely interest in the Academy's views on this topic. So we'll be working on those, and then they're looking to possibly vote on the single approach at the fall national meeting in Denver. Also related to long-term care, there's some interest in our upcoming work that the Academy is working on. We're producing a couple different issue briefs. One's going to be on the state of LTC long-term care, and the other is going to be the impact of COVID on long-term care insurance. These are working titles at this point, but they're currently in review and looking to get those out within the near future. Specifically the one on COVID-19, that's actually an update of our issue brief that we produced in 2021. So how have things gone since the public emergency ended in regards to COVID, and where do things stand at the moment with long-term care insurance? In relation to health equity, there were some interest on data issues. What data is applicable and what is available to regulators and insurance industry related to health equity initiatives, and what does that data look like? So there was definitely some discussion on that. So that's something we're gonna keep track of going forward. With that, I would like to hand things over to Will, our RoomFric analyst, to talk about some of the key takeaways from the RoomFric Practice Council. So I'll hand it over to Will.
Thank you, Matthew. So as Matthew mentioned, I'm Will. I'm the Risk Management and Financial Reporting Policy Analyst for the Academy. So as we talked about before, we engaged with several NAIC committees and work groups. So there are no formal RIMFRIC presentations to any of the groups, but at the top of the slide, you can see several groups where Academy work products were mentioned from various RIMFRIC groups across the numerous subjects that our volunteers work with. One of which is also a key priority for us is AI governance, which was discussed in length at the Innovation and Cybersecurity and Technology Committee, or the AIDS Committee, where the chair of the Data Science and Analytics Committee, Dorothy Andrews, presented on her engagement across the industry with AI and AI governance broadly. She presented on behalf of the AI Task Force, which is designed to monitor global AI governance and evaluate different kinds of governance frameworks different countries and different organizations have, and identify gaps in areas where actuarial expertise can contribute. Part of which is a new program launched by NIST, which is called ARIA, which is Assessing Risks and Impacts of AI, which is a new program to advance socio-technological testing for and evaluation for AI, which is intended to assess the societal risks and impacts of AI systems, which is a key entity that the Academy as a whole, but specifically DSAC, will continue to monitor and potentially participate in the future, see what they produce. Moving along to the international monitoring updates and just the general international insurance industry, discussed largely with the G Committee. So the IMF produced an update mostly revolving around a global financial security note they produced this past year on private equity and life insurers. So they based their update around a couple of key themes in the paper, including just the general growth of private equity since the global financial crisis, as well as private credit, and then the growth of private equity influenced reinsurers, which members of RIMFRIC Practice Council have been engaged with in the past few months. IAIS has also presented an update on their numerous public consultations in the past year. So recently, at the last quarter of 2023, the package 2 of 4 was exposed for comments by IAIS on their climate risk initiatives. So that comment period closed in February, and numerous committees within RIMFRIC committed comment letters, and the update was they are still considering comments, as well as preparing package 3 for a public consultation soon, which covers climate-related issues, including the guidance in ICPs 15, which is investments, 16, and their supporting materials, as well as ICPs 7, which is corporate governance, as well as 8, which is of risk management and internal controls. There is plans for a 4th package as well to be released following package 3, which will be either in the tail end of 2024 or the very beginning of 2025. With that, the other key priorities that RIMFRIC groups were participating in and following were the statutory accounting principles that NAIC has been working on in the past few months. So the E working group exposed numerous new initiatives, a few of which I'll detail that are particularly interesting to our committees. So one of them is SAP 86, which is a derivatives-based exposure, and it's concerning new guidance for interest rate hedging that do not qualify as accounting effective hedges under S86, but are used for asset liability management. Another one of those is SAP 108, which is another SAP 108, which is another derivative hedging variable, which guarantees annuity revisions and expose the definition of clearly defined hedging strategies to reflect guidance compatible to the Valuation Manual 1. And finally, another IAIS group exposed a new application paper on climate risk, which came from their audit and accounting work group. And their exposure period will begin shortly. With that, a few other RIMFRIC topics and papers and issue briefs that were discussed were the Climatic Events, Inequalities, and Risk Mitigation Issue Brief, which is a cross-practice paper that covers a variety of different insurance-related topics, was released by our Climate Change Joint Committee recently. So that was discussed in numerous NAIC committees, as well as just a continued discussion on reinsurance and AI governance-related topics, which RIMFRIC committees will continue to participate in and produce work products in the future. With that, covers the RIMFRIC practice updates. So I will turn it over to Ramzia to cover research.
I'm Ramzia Shakirova, Senior Research Analyst at the Academy. From the research perspective, it was a very productive meeting. We presented our research proposal on drivers of expenses in title insurance to the title insurance task force of NAIC, and our proposal was very well received. There is a great interest in research on title insurance. We also had several productive conversations with the representatives of different organizations and different groups and committees at the meeting. We talked to the representative of American Land Title Association to assure their cooperation on a research project. We also talked to the Life Practice Council staff of NAIC on coordinating on VM22 field test, and also on assisting us in an upcoming emerging risks survey. We also had a good conversation with the director of the Center for Insurance and Policy Research, Jeff Tchaikovsky, and talked to the chair of the Innovation, Cybersecurity and Technology Committee about future academic presentations and cyber risk and AI.
Well, thank you so much, Ramzia, for that update. So, looking ahead, the Academy had a lot of engagement with regulators and other stakeholders in the Windy City. But what can we expect from NAIC in the coming months leading up to the November meeting in Denver? Again, I turn to Amanda to share what lies ahead for the LPC.
Thank you, Ted. So So two big takeaways looking ahead to Denver. The first is that the LPC's C1 subcommittee is going to be providing an update on a research project that they're working with the research committee at the Academy on comparable attributes for collateralized loan obligations, or CLOs. So that update will be provided in Denver. I don't think that the project will be completed at that time, but there will be a substantive update on how the work is going. And then the other thing to look forward to is the continued discussion on offshore reinsurance and the AAT actuarial guideline that was exposed in Chicago. As I previously mentioned, there's several deadlines between now and Denver, several comment deadlines that the LPC will be responsive to, and we're looking forward to a substantive discussion on comments received to the actuarial guideline specifically about several sections of the actuarial guideline in Denver. So that's my update.
Thank you, Amanda, for that. Rob, what can we expect from casualty in Denver?
So as previously mentioned, the Committee on Equity and Fairness is looking to present at the next Anti-Fraud Task Force public meeting in Denver. They'll be presenting on insurance fraud impacts on premiums and claim costs and the public, that paper, and we are excited to engage with them. And then also we're hoping that the diversification across lines of business report from our PNC RBC committee will be published to we can present on to the CAT risk and PNC working group joint meeting. But if not, we will definitely have a meatier presentation than this time around, where we just provided a report out in writing to the chair of that working group. So exciting for both of those fronts.
Great. Rob, thank you for that. Pike for HPC in the fall.
Thank you, Ted. Yeah, I just wanted to reiterate just the ongoing discussion with the long-term care actual working group at the NAIC, that they're looking to possibly vote on a single long-term care insurance MSA rate review approach at the Denver meeting. And as mentioned before, they're looking for comments on that approach that are going to be due on September 27th, so here in about a month. Also, the Academy is looking to submit the final drafted life and health knowledge statements to both the Life Actuarial Task Force and the Health Actuarial Task Force at the Denver meeting.
That, Matthew. And finally, Ramzia, what does research have on tap for Denver?
For the fall meeting, we have been asked to present on title insurance. So we will present some findings and results from our title insurance research project. And we may also present our research on climate change and cyber risk.
Thank you, Ramzia. We hope you have enjoyed this post-NAIC webinar. If you have any questions on the activities we've highlighted or want to know more about the Academy's engagement with the NAIC, please reach out to any of the staff on this webinar. We can all be found on the website, www.actuary.org, and our contact information is included in the attached slide deck. You can always reach out to the team by emailing publicpolicy@actuary.org. We'll also encourage you to check out the public policy page on the Academy's website. You'll find more information on the issues and priorities of the Academy, links to upcoming and future webinars, including the next in the series, and how to volunteer yourself. Finally, head over to www.contingencies.org to peruse both the Election 2024 Issues Clearinghouse as well as the Actuarially Sound blog. We hope that you will join us again this fall following the NAIC's Fall National Meeting scheduled for November 16th through 20th in Denver. And don't be shy. Tell your colleagues and coworkers about this webinar so they can get in on all that the Academy and the NAIC are doing together in the insurance space. Until then, be well.